Indiana lawmakers want to invest more state funding in mental health. A bill with bipartisan backing had its first hearing on Thursday. Our State House reporter Kristen Eskow was there. She shows us how lawmakers want to use those funds.
It does truly touch everyone.
That sentiment shone through the testimony of several Hoosiers Thursday who are urging lawmakers to approve more state funding for mental health. Kathy Weinman spoke about her grandson with autism.
If he finds himself in an emergency situation, I can tell you what will happen. He will have a complete and total meltdown.
And Lieutenant Governor Suzanne Crouch told the stories of mental health struggles in her family.
I was raised by a mother who suffered from depression. My sister Nancy died by suicide in her early 20s. We just buried my brother Larry in November. He was an alcoholic.
Crouch co-chairs the Indiana Mental Health Roundtable, which advocates for ways to improve access to care.
The untreated cost of mental illness in Indiana is over $4 billion. So we cannot afford not to pass Senate Bill 1.
The bill has been introduced by Republican State Senator Michael Kreider. He says the goal is to provide a more effective response to mental health crises. It would allocate $30 million toward expanding the number of certified community behavioral health clinics, which provide care 24/7.
We can get that help to folks when they need it immediately or as early as possible. They won't end up in our emergency rooms, and hopefully they will not end up in our county jails.
The bill also funds the 988 Crisis Lifeline. Several lawmakers say they want to see that funding continue for years to come. From the Indiana State House, I'm Kristen Eskow.
The Senate Appropriations Committee heard testimony on the bill, but it didn't take a vote Thursday. The committee chairman says they'll consider some changes to the bill and take a committee vote as soon as next week.